Hello, everyone. My name is Acklin, a current third-year OBGYN resident at the Morehouse School of Medicine, and I'm happy to be presenting my research titled Implementing Cardiac Screening for Postpartum Patients in a Safety Net Hospital. Before beginning, I would like to share that I have no financial disclosures or conflicts of interest with the presented material in this presentation. In 2022, the Georgia Maternal Mortality Review Committee identified the leading causes of death during pregnancy. It was during this evaluation that the committee discovered that 65% of these events occurred in the postpartum period, and cardiovascular disease was the number one cause of death. After thorough review, it was also revealed that 87% of pregnancy-related deaths could have been prevented. These findings beg the question, what risk factors are associated with increased risk of cardiovascular disease in pregnancy? These can include shortness of breath, fatigue, lower extremity edema, history of chronic hypertension or diabetes, and even obesity, all of which can sometimes be masked as normal symptoms of pregnancy. This also led us to wonder, what ways are patients falling through the cracks, especially in the antepartum and postpartum period? This can be delayed or inadequate response to clinical signs and symptoms. As I stated before, some of these things we sometimes just attribute to normal symptoms of pregnancy. Also, ineffective or inappropriate treatment, misdiagnosis, and failure to involve their consulting services. Similarly, in 2016, the state of California's Maternal Morbidity Review Committee were met with the same phenomena and were able to retrospectively create a screening tool to identify cases of cardiovascular disease that could be identified and have potentially saved lives. To this effort, our project aimed to implement the California Maternal Quality Care Collaborative Cardiac Assessment and a statewide quality improvement initiative to screen for cardiovascular disease. Our plan was to screen postpartum patients delivered by the Morehouse team at GRADY Hospital, and based on these screenings, triage patients as needing no further evaluation versus a preliminary cardiac screening. Patients were screened on postpartum or post-op day 1 through the months of July through December of 2024. A positive screen could result from the following: 1 red flag symptom, or 1 positive symptom, vital signs, or risk factor, or a total of 4 moderate risk factors. If a patient screened positive, an EKG and BMP were ordered. No patients were excluded from screening. Out of the deliveries that occurred during this time period, 113 patients were screened, with 5 noted to have screened positive. Our total positive screen rate was 4.4%. And it's also notable that our population had a high ratio of patients who identify as Black. And we know that this is important because maternal mortality and morbidity disproportionately affects the Black community. Some of our strengths included proactive evaluation of patients in the immediate postpartum period, but there was notable inconsistency with provider implementation that led to missed screenings. From this data, our goal is to implement screening throughout pregnancy. This includes up to 1 year postpartum. To do this, we need the help of all clinicians involved in pre- and postnatal care. This includes finding dedicated cardio OB clinicians that can appropriately follow up for our patients who might be at higher risk of cardiovascular disease. We would like to thank you all for your time and consideration. We hope that this project encourages you to improve maternal mortality and morbidity in your community.